Hello, welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today is Sabrina Fadrell from the Department of Social Service. Welcome, Sabrina.
Hi.
I want to start by just tell us a little about yourself.
My name is Sabrina Fadrell, and I've been with Caldwell County DSS. And matter of fact, tomorrow will be my 18-year anniversary. So I've been here for 18 years, and I've been specializing in Medicaid ever since.
So you really are the expert in the room to talk to us about these Medicaid changes.
I hope I'm the expert.
So tell us, what is managed care or Medicaid transformation?
Okay. What it is North Carolina has always been a fee for service for the clients, and it is need to build as provided for the North Carolina Medicaid. In 2015, our state decided to move to managed care, and this means that the clients get to pick their own plans, but their needs that will fit their needs, and the plans are to be responsible for billing and paying for the clients' services.
So ideally, this will be better for the client. I mean, that's the target here.
Yes, it will still be underneath the Medicaid program, but what it is, they actually have different Carolina providers where it's actually insurance, but it's still underneath the Medicaid program.
So what do you mean about clients picking their plans?
What it is that the state took bids back in 2017-18 to reach out to providers to see who would be interested in becoming a provider for the Medicaid clients. So what this is that the Medicaid clients get to choose their provider that best fit their family's needs. So instead of just being, it's still Medicaid, but they actually get to pick an actual insurance that fit their individual needs.
Who are the providers here in North Carolina?
Caldwell County.
Caldwell County.
Yes, ma'am. Caldwell County have 4 providers thus far, and it's Blue Cross Blue Shield, AmeriCare, Cartus, I hope I'm pronouncing it right, Cartus. And then we have WellCare of North Carolina, and we also have United Healthcare.
Why are there 4 different providers for the county?
It's better for the county because it provides the services for this region. And so it's just giving the opportunity for the clients to have more than one selection instead of just putting everybody underneath one umbrella. They get to choose again that fits their needs for their family needs.
And each of these different providers may have different incentives, is that correct?
Correct. The package has already been mailed out to the clients in regards to what different incentives that Blue Cross Blue Shield, AmeriHealth, United Healthcare, and WellCare of North Carolina may provide. So it's like, say for instance that you have someone that may be a diabetic. Well, United Healthcare may be the better suit for that individual because it may cover the supplies, versus Blue Cross Blue Shield may not cover the supplies if you're a diabetic. So that's why it's very important that we encourage the clients when they receive the packets to definitely read through it to make sure you pick the right plan for your family.
When does this start? When do these plans go into effect?
Well, the open enrollment has already started. It started on March the 15th, and it continues through May the 14th. And while we encourage the clients to make sure they read the packets and go ahead and enroll during this time, is because it's not guaranteed that you would be able to keep your physician that you may be comfortable with now if you do not pick your plan. So you have to definitely read the choices of the plans that you have through the providers to see which one fits your family, because if not, then the state will automatically enroll you into one that may not be underneath your physician that you want, and you're not going to be able to change it.
Well, that was going to be my next question. What happens if you don't enroll? That you may lose the physician you've had for years.
Correct. And then the thing is with it is because underneath the old way, they used to call in and change their provider at any given time if they choose to, and the following month it would get changed. But underneath this program, they have to pick a plan that keeps their physician, because if not, they're going to have to keep that physician for 12 months or until the next enrollment is due.
And that's a long time,
Yes.
especially if you have a relationship with your physician.
Yes, yes.
So that is a very important reason to go ahead and take a look at these plans.
Yes, ma'am.
Will this affect every person on Medicaid?
Not at the beginning. It will not affect everyone. Medicaid have different programs within itself. Certain benefit programs will roll out at different times. So at that time, again, we encourage them to look through their mail when they receive something regarding Medicaid, to definitely read through it, because it's probably most likely 9 times out of 10 is regarding a change or something that you need to make quick action on before the state actually enrolls you in it.
So if you didn't receive a packet, you probably are not impacted by this.
I won't say that.
I won't say that.
I won't
okay.
say that.
So I'm making assumptions.
If they have not received a packet and they know that they are currently receiving Medicaid, I would advise them and encourage them to call the local office so that we could give them the broker's number, because that's who they would have to go through. It's not through us. Because so many people is used to calling down there to speak to their caseworker and everything, and they still can. But when it comes to picking a plan, Medicaid plan, they would have to go through the broker to do that.
So, and that was going to be my next question about the enrollment broker and how they help you.
Yes, the enrollment broker will be able to give them more in depth about the plans and what the incentives are for that particular Medicaid program that they wish to choose, like Blue Cross Blue Shield. They could give them more ideas of what the incentives is if they do not understand, or they may be able to ask more questions in regards to their household situation, where they could be like, they cannot make suggestions, but they could gear them into the right direction on which one may cover those, like I said, diabetic. If you're diabetic, the supplies, they could better guide them on which one would be good for them.
And there are a lot of questions. I know I talk with the Senior Center about health insurance for seniors, and it can get really confusing. So having that broker there, someone who knows the plans, is pretty important.
Yes, ma'am. And again, we encourage them to definitely reach out to the broker to get further assistance if they do not understand the program. But they also could call down to DSS, because we also have the information as well to guide them.
How is DSS helping people with this program and this change?
Well, again, the enrollment package was mailed out early on in March, and also before the open enrollment even took place, starting on March the 15th, information was gradually being mailed out to the clients to get them a little bit of knowledgeable of what the change was going to come about, so there wouldn't be just push on them and then they all of a sudden be in shock. So it was gradually implemented for them to know what was coming ahead of time so that they could be prepared. And so when they received the packet, it wasn't as much as they didn't know what it was. We have received a couple of calls in regards to they wasn't understanding how the broker worked. They understood about the different plans that they were offered, but by them having to pick a plan was very confusing to some. So what people don't understand is that, say for instance, you have 3 children. Well, you don't have to have all 3 children underneath Blue Cross Blue Shield, Americares, and you don't have to have United Healthcare. You can have one under Blue Cross Blue Shield. You may have one underneath Well Care of North Carolina. So they don't have to be underneath the same umbrella. So they pick what's best for that individual.
For the individual.
Yes,
so it is a little bit complicated, and you have to look at each child's needs, each member of your family's needs when you're looking at that.
Yes, ma'am. Because see, some may also have an incentive where they give you a free cell phone service, where you'll be able to, call your doctor's office to make sure to keep up on your appointments. Like I said, with the diabetic. It's just so many things, and that's why I keep stressing. I encourage the clients to make sure that you read the paperwork that comes through the mail, because a lot of people will be like, oh, this is just Medicaid, and toss the letter. But I encourage you to please open that letter, because it may regard a change or something that you need to act on as soon as possible.
And we've mentioned several times calling the enrollment broker.
Yes.
What is the number for that enrollment broker?
The number, and it is toll free, is 1-833-570-5500.
Okay, and we will put that up on the screen. And there's also a website.
Yes, the website is NC Medicaid Plans. That's altogether.gov.
And I looked on that this morning preparing for this, and there's a lot of information on there.
Yes, it is.
I mean, and that's just on page 1. I did not get into like looking at the individual plans, but there's a lot of information. So it's something you really need to sit down and take your time to look at.
Yes, ma'am, and be sure that you make sure that if you don't understand something, to definitely call the broker to walk you through it or answer questions that you're not able to receive from us. Because it's very important that you pick the right plan for your child, because again, I stress that once you pick that plan, you're going to be in it for 12 months or until the next review is due. So I really, really encourage them to read the paperwork and the information that is being mailed out to them.
And call that broker, because
Yes.
in the past they've called you.
Correct. Because we could still at times be able to change the provider if they wanted to change the doctor's, the physician's office, but we no longer could assist them with that. They have to go through the broker to do that.
And when is all this taking place?
Well, it's taking place now.
It's taking place now.
Yes, it started on March the 15th, and it will end on May the 14th. The thing is if they do not have everything that is needed or enrolled in July the 1st, the state will definitely be automatically assigning them provider. And that's what you don't want if you want to keep your same physician, because it's not guaranteed that the Medicaid provider plan that they put you on is going to have that physician underneath that program.
And that's probably something we should point out now, is when people are looking at the plans, they need to make sure their physician, their healthcare provider takes whichever plan they're looking at.
Right, and that's excellent that you brought that up, because it is this may be something you want to discuss with your physician now. So if you want Blue Cross Blue Shield, you may need to ask them, are they going to be able to still see you with this program? Mainly if it's a doctor that knows your child's situation, your history, and you just feel comfortable with them, that's a good point that I would definitely advise them to ask their physician, because somebody may take Blue Cross Blue Shield, but they won't take United Healthcare, even though United Healthcare is covering your child's needs at this particular time where Blue Cross Blue Shield is not. So yes, that's a good one. Yes.
And that's a lot to weigh. This plan covers the medicines I need better, but this plan is the one my doctor's in. So
Yes.
really, people are being asked to make some really tough decisions here.
Yes, and it becomes a little bit of mind-boggling to them and overwhelming to them, because it is different and it is change, and a lot of people do not adapt to change well at all. So I definitely would encourage them again that if you have any questions, you still could call down to DSS, but 9 times out of 10 we're going to refer you to the broker. So make sure you remember the number 1-833-570-5500. It is a toll-free number. You don't have to pay for the call. It is toll-free. So to be able to answer the questions that we may not be able to, not saying we're not able to answer them, but we need to get them used to going to the broker to assist them with the plans.
So it's really a lot to think about. And I would suggest, personally, I would have to take this in bite-sized chunks. I couldn't sit down all in one day and just do it. I would have to absorb a little bit at a time, because...
Yes, and it is overwhelming. When we had training over it, it was just really like, wow, it's a lot. And at first when we was looking at it, I know me as an individual, I was like, oh my God, this is a lot for them. I said, oh, they may not adapt to the change that fast, because they're so used to contacting their caseworker. So that, it's going to definitely be overwhelming at first, but I think it's going to be better in the future once they get used to it and set up and get everything rolling.
So we ask you to be patient as we work through this.
Change, yes, because it is going to be a change. So, and then a lot of things that the good thing is that they have a lot of the stuff already in NC-FAST where it's adapting to the change. So that's a good thing for us to be able to still process the paperwork in a timely manner that we need to. So only thing I could just really say, encourage you, is just to make sure that you definitely get in touch with the broker and read the information that is mailed out to you. And it's most of the letters are, a lot of people think that we generate the letters from our office, but most of the letters are coming from the state office. So, and if you call our office in regards to the letter that you receive, it would be good. We encourage you to have the letter in front of you because there's different letters going out to different people due to their situation. So we're not going to know exactly what it is until you could read the letter to us, and then we can be like, okay, this is what this is about, because we don't want to give them any false information thinking that it may be this.
Right.
Because a lot of people may call us and ask a particular question, and we answering it the way you asking us, but that may not be what you need. So we encourage them to definitely.
So it's not only a lot for the people who receive Medicaid benefits, it's a lot for your staff to learn.
Yes, yes it is. Yes,
and there's a lot of facets to this. So
Yes.
Again, please be patient.
Yes. Please be patient with us. We're pushing out the paperwork as fast as we can, as normal. But whenever there's a change with the program, there's a change with us as well. And so it's a lot at first for us because we get overwhelmed too. Because we get used to this, and then they change this, and now it's this. And we've been, the good thing is about it is because we have been in training over the process of this rolling out. So it's been years in the making. It's just coming to forefront now.
And really, this was supposed to roll out last year.
Yes, yes,
Last
and it got
year,
pushed back.
and as I've said so many times, and then COVID.
Yes, ma'am.
So that pushed everything back, but now it really is here. These deadlines are coming. You have about a month
Yes.
to make that decision, but look through that paperwork, call the enrollment broker.
Yes, and we have the information at DSS, so you can call there, and we also can give you the information there. But you have more information on the packet that they receive individually, so it would be good. Again, we encourage them to read the packet because majority of the information is there, because different plans have different numbers to call, different providers to call for transportation, for if you have it in regards to your prescriptions. So whatever program you pick, the Medicaid plan you pick, they have their own specifications that you will have to follow, and it's not easy for us to keep going back and forth to see what is what. So
the brokers are the way to go.
Yes.
And as you're talking about prescriptions, I would encourage people to write down your prescriptions so you can see, and you can ask specifically when you're talking to the broker, do you cover this medicine?
Right, and also it's a lot of people, when you said about the prescription part, a lot of people do the mail order prescription. So again, you need to see which one fit that need of you. If you order more of your prescription through the mail and get more quantity at better cost, then you actually don't go in through the pharmacy. So yes, that's good too. That's definitely something good to look at as well. So like I said, it's going to be overwhelming at first, and it's going to be a lot of information going out to them all at once. But it's definitely important that you read through the information to see what best fits your family. And that's a good thing in a way, because they get to choose the plan that fits your family instead of just be given, okay, everybody's underneath this one umbrella. But even though it's underneath one umbrella, it's really not suitable for everybody in the household. So, but at least at this change, you get to choose your plan.
And like you said earlier, you choose based on the needs of the individual in your family, that child.
The adult.
The adult, whoever that person is,
Yes,
and their
ma'am.
needs, because, the child may have a medication they take, but another child may not take any.
Correct.
So it really is, it will be a good change.
Yes.
It's just getting through the change.
Yes, in time.
In time. Sabrina, have I forgotten anything? Anything else we need to mention?
No, I think we have covered everything. I think that would be suitable, the information going out to the clients that is informative. We try to be as specific as we can and tell as much as we can to it, but again, I do encourage them to read the packet, because that packet really does give you more information than we can give to you over the phone. But you definitely can call the broker to assist you more in making sure that you're picking the right plan for the individuals in your household. So definitely, and also be sure to write that 800 number down anytime, because it will be suitable. They also have a time frame, Monday through Fridays. There are times that they could be reached. On the weekends, sometimes be reached. And then just remind them also that a lot of notifications are coming out from the state office. It's not done from us at the local office. It's from the state office that are generating letters. And the reason it is because the Pacific plan that you pick is not going to be the same letter for each child or each adult that's in the home. So that's why we encourage again to make sure you open up every mail that comes through in regards to Medicaid, because it's not going to affect just one child. It's going to affect different people in your household depending on what plan you select.
So when you see something that's pertaining to Medicaid, open it immediately.
Yes, definitely. Don't toss it.
Don't toss it.
Yes.
Open it and read it.
Yes.
Sabrina, thank you for being here and for all this information.
Thank you for having us. We greatly appreciate it, and to get more information out to the clients. Yes.
And thank you for watching Caldwell Today.